and I shall adjourn the meeting if necessary if protocol is not observed. Members of the public are welcome to view the proceedings but should not make contributions until they are invited in line with our procedure. All members of the committee have received the reports and associated documents in advance and had the opportunity to read them. The public reports are published on the internet. All participants should mute their microphones and video feed when they are not speaking, and that does help with the technology. It makes it a lot better for us if we all mute. I will also do the same when I'm not speaking. Please remember to unmute your microphone and switch on your video feed when it is your turn to speak. Speak clearly and slowly into your microphone. Anyone wishing to speak should indicate using the raise your hand button on Microsoft Teams, and I will invite people to speak at the appropriate time. If you do not have the hand button, please type your request to speak in the chat function, or other than that, just wave at me. Please note that the chat function is monitored and has a full audit trail, and anyone found to be misusing this function, I'm sorry to say, will be removed from the meeting. We have had issues with this in the past, not particularly this committee though. Finally, I ask for everyone's patience with the use of technology. I apologise in advance if we experience any unforeseen difficulties, which we shall try to resolve expediently. And I will now move on to the agenda items as listed. So agenda item 2, apologies for absence. We've got Paul Bradley. Anybody else, Kim?
No, Chair.
Thank you. To report the appointment of any substitute members serving for this meeting of the committee. Any substitutes?
Councillor Lee, Chair, for Councillor Bradley.
Right, thank you. To confirm and sign the minutes of the meeting held on the 11th of November 2020 as a correct record. Does everybody wish that, does everybody confirm that this is a correct record of the minutes and that I can sign them?
Aye.
Aye. Thank you. Right, we move on to agenda item 6, which is the Children's Services update. Acting Director of Children's Services, Helen Ellis. Over to you, Helen.
Okay, thank you. Thanks, Chair. Okay, I'm just going to give you a verbal update in terms of where we're at with children's. So just to let Scrutiny know that our new Director for Children's Services starts on the 22nd of February, which is really good news for children's services. We continue to manage COVID. This particular lockdown has brought a number of challenges, as you're all aware, mainly around from the 4th of January around all the support to schools and managing the various DfE guidance that's been coming through. We have got a couple of our buildings open. So Corbin Road, which is our social work hub, is open. And we've got one of our family centres open at the moment, which is Stowridge Family Centre. So not open to the public, but it's open to staff. Staff continue to risk assess and carry out visits as appropriate to support families in the borough. We've started to look at the vaccination, and a number of our frontline workers have started to be vaccinated, which is really good news. As I described at the beginning, we've been supporting schools this term around lateral flow testing and supporting schools with various issues in relation to COVID. So that continues, and we'll continue to manage the COVID issues and challenges as they arise. In terms of our improvement plan, and this is in relation to social care, that is one of our priorities. As you're all aware, we had our Ofsted assurance visit in October. As a result of that visit, we have put an improvement plan together. That improvement plan has 9 key priorities. Those 9 key priorities for us are leadership, our MASH, quality of assessment and plans, pre-proceedings, permanency, education at key stage 4 for our children looked after, case transition, non-familiar abuse and exploitation, supervision, quality assurance and management oversight. And of course, the voice of the child, which is our golden thread all the way through our plan, as is our workforce. I spoke to the chair earlier on. We had a pre-meet and we're going to bring the detailed improvement plan to the scrutiny board on the 17th of March. Okay, the other area that I just want to update you on is successor. Just to remind scrutiny that we went live on the 16th of November. We have had teething problems, as you'd imagine, and which is what I reported, mainly around data reporting. That has resulted in quite a priority for us to ensure that we've got the right data sets and the right reports for our managers to be able to effectively manage services. So that's been escalated through and that's being dealt with as we speak. And we've started phase 2 of the implementation programme, and phase 2 is about developing the children's portal, which will allow us to exchange partner information about children. So that's really positive. That's my summary as it stands at the moment, Chair.
Thank you for that, Helen. Has anybody got any questions that they wish to ask of Helen? Right, I think it's Councillor Sahota. Is that right? Yeah. Go ahead, Parmjit. Oh. I think we'll go to Councillor Sue Ridney.
Thank you, Chair. Just a few points of clarification, really, Helen. You say you've had some in sporting schools. Everyone will have read the press and seen the photographs on social media. One about the free school meals. Can I just have some clarification? At the moment, we are issuing parcels. My understanding from speaking with you earlier is that from the 1st of February, we go back to vouchers.
Yeah.
I have had a query. I've had a query today. Schools that I was aware that the voucher scheme, free school meals is worth £12. The vouchers are 15. Therefore, that means the shortfall of £3 when we issue a voucher. My understanding is at the moment that's being made up not by the schools, by the authority. Is that correct?
Yes. So so vouchers are £15 a week, and the hampers should be of the value of £15 as well, Councillor Ridney. In terms of the voucher and the hamper conversation, is that the majority of our schools are going down the voucher route, but we have got a handful of schools that but because of the provider that they use, they've got no choice but to use hampers.
That I think is the local authority, isn't it? It's local catering, because we've got a stock of stuff that needs to be used up.
Yeah, that was a couple of weeks ago before we got the DfE guidance. So we needed to use the stock. So now we've used the stock, we're going into the voucher scheme as well. But as I said, there will still be a handful of schools that will still be using hampers. But the majority of our schools in Dudley will be using vouchers.
I'm sure we'd all like to have clarity from the DfE. It seems it changes by the day, as I've seen you when you've been tearing your hair out when we've spoken. Just one more. So there are no schools actually owed money for the voucher scheme. It is the authority that's picking that value up.
Yeah, the authorities picked up the issue that was about 2 weeks ago, but from now schools are able to claim that money from the DfE.
Directly,
directly. And if schools have had problems, which we have had problems, the LA are supporting those schools.
It's just I've had a query about our schools still owed money, because obviously we're coming into the end of that financial year and schools will be wanting to plan their budgets from April, but that's not going to be easy for anybody this year, because nobody knows how much it's going to be at this moment in time, do we? No. It's like we're playing in the dark here. Okay, thank you. I don't think there was anything else, and I will say, you know, best of luck with success. You are going to have teething problems. I'm not going to be critical. I'm sure the chair will agree with me. We're just so glad to have it. But
Yeah.
you will,
Yes, we are.
but you will have teething problems, and we do appreciate that. Let's just keep it a shorter period as possible for those teething problems, please.
Yeah.
Thank you, Chair.
Thank you, Councillor Ridley. Can I go to Councillor Sahota? Can you? I think you were on mute before, Palmjit.
Yeah. So can you hear me now?
We can.
Can you hear me now?
Yeah.
Yes, we can.
Okay.
Yeah.
Just thank you, Helen, for the obviously update. Just a couple of questions, really. Obviously, staff supporting staff is a critical thing. Obviously, in terms of delivering our services from your service area. What issues have there been, and how have we supported the staff in terms of, you know, managing the staff, supporting the staff, but also managing the workload that still is there with the pressures with the pressures of staffing, people off sick or isolating, etc.
Okay. Well, I you know, it is a challenge. I can't deny that it's not a challenge. We are making sure that staff are feeling supported. There's a lot of emotional health and
Palmjit,
well.
hang on a minute. Palmjit, can you turn off your video? Thank you, and the mic. Thank you.
Okay. There
Okay,
is. Thank you. The council have put on quite a tight programme of emotional health and wellbeing support for staff. So our staff are accessing that support. Staff are being supported by managers with close supervision. All of our staff have got PPE. As I described, our staff are starting to receive vaccinations now. Those are our frontline workers, and that's all in line with a priority list from the national priority list in relation to vaccinations, which includes social care. That has been a morale boost, I've got to say, in terms of staff starting to receive those vaccinations. Having centres open for staff has also been a form of support, peer support, working within COVID restricted buildings. So there's social distancing, usage of PPE in buildings, but just to have that peer support and management support by being in the building has made a difference as well to staff. So to kind of just summarise, there's a whole series of support and tools that we're using, but I can't deny it's not a challenge. COVID, managing business as usual and improving all at the same time is quite a challenge, but we are working hard to ensure that our staff are supported. Because it's, as I said, it's an absolute priority for us to ensure that staff feel secure and supported during this difficult time.
Is that okay, Councillor Sahota?
Chair, thank you.
Okay, can I move to Councillor Pete Lee? I believe has got his hand up. Peter.
Yeah. Thanks, Chair. I've got just a couple of quick questions. The new head of children's, where does she come from? Does she come from another children's department somewhere? Or did she had loads of experience, in other words?
Yeah, Catherine Driscoll's really experienced director. She's
Right.
currently working at Worcester. So Catherine comes from Worcester, but she's got a wealth of director experience. So we're really pleased that Catherine's coming to Dudley.
Lovely. Okay. One last question about the vouchers, going back onto the school vouchers. Is there any way that those vouchers can stores be forewarned that the vouchers are only to be used for food products and not, say, fags and beer? Is there any way that can be enforced in any way?
That should be the case, Councillor Lee. If it's not, if you could drop me an email, all of our supermarkets know and understand that those vouchers should only be used for food.
Okay.
So in terms of supermarkets in the borough, they all know. So if there's a
Lovely.
problem, if you could let me know, then we can pick
Okay.
it up.
No, it's just a general inquiry because I know that was a thing in the past with the vouchers.
Yeah.
Some people were buying cigarettes and fat, you know, and beer and not buying food for the children. I mean, bad parenting, we know. But yeah, thank you. Thanks very much for that.
Thank you.
Thank you. Thanks,
Okay,
Chair.
thank you, Peter. Thank you. Then now somebody else. Is it Councillor Ridney again? You've
It
got your
is.
hand up.
It
Okay,
is. It
so-
is. Sorry, Helen. Having heard the news today, they're now querying the lateral flow tests in secondary schools. Have you had any notifications of that yet?
Yeah, we've had we had a bit of a blip today, as you know, Councillor Ridney, because of what you've just said, where it was paused. I haven't picked up the detail because I've been in meetings all afternoon. Jeremy has. Jeremy, do you want to just come in on this, if you can, please? Because I know that you've been dealing with it this afternoon, because it's absolute hot off the press, isn't it, today?
Yeah, we were actually. Thank you, Chair. We were actually in the middle of a meeting. We were about to talk to all our colleagues, the 3 principals of the major colleges in Dudley, and it came through about 9:30, 10 o'clock this morning. Essentially, the programme is still continuing, but what the slight change is that previously they were using lateral flow testing with all of the children on a weekly basis and the staff. And the previous position was if a person tested positive, then other close contacts in a bubble could stay in school if they tested negative. The guidance has now changed so that if someone is in a bubble where someone tests positive, the other close contacts now have to self-isolate. So we're going back to the position that we were in previously this academic year. I think it's just because, to be honest, there's a lack of confidence now in some of the testing. I think across the country, since they trialled this in Liverpool a long time back, they've realised that there is about 20 or 30% of these tests that come back with false negatives. So there's a lack of confidence, I think, in the negatives. So they're going back to a sort of belt and braces approach, which is if you are in a bubble with someone who's tested positive, you self-isolate. The rest of it carries on as before.
Can I just say, Chair, I think this is absolutely appalling. I really do. I think our schools have been through the mill. And I'm not getting at Helen or any of our, I'm getting at the government really. This is an absolutely appalling situation. Our schools have been put through the mill. Our children have been put through the mill. It's a terribly, terribly difficult time and challenging time for everyone without this swapping and changing. It's just policies being made on the run without actually considering them. As Jeremy has just said, we go back to what it was originally. It's backwards and forwards like a yo-yo. This is really not helping our schools, not helping our young people, and especially those in secondary, because they're the ones that are faced with this. My understanding was that this was to begin in primary schools at the end of this month. How will that now affect it? Do you know, Jeremy?
We're still waiting for that guidance, Councillor Ridney, but the one thing you can be reassured, and reassured all of you in Chair, is that we got the communication out very quickly within a matter of minutes that we heard the news. We got it out. So
I'm sure you did, but I think what can also be assured of, this is going to be another cock up, you know, because that seems to be what it is. We're just swinging backward and forward. I am just appalled really that our schools are being put through this with everything else. I'm not getting at you, it's not your fault, I know, and you're doing your best to get it out, but I'm sorry, I just need to make the point that this is messing these schools about and messing these young people about. It's bad enough for everyone, but this is just not up to the mark, and I do hope the DfE are listening in on this, because it's about time they got their act together. Thank you, Chair.
Well, I've got to say, Councillor Ridney, I cannot disagree with a single thing that you have said. And I think that, you know, we're all facing very, very difficult times. I think our schools are doing the very best that they can. I mean, as a personal opinion, I never agreed with the schools having to roll out these testings in the first place. But it is what it is. And you are aware that I wrote to the to Gavin Williamson, and I'm still awaiting a reply over another issue. And it seems to me that we're not getting the message through, or they're not listening to us, because we are the delivery face. We have to deal with these policy changes that come through on a Friday, a Saturday and a Sunday by Monday morning. And I would not be a head teacher for all the money in the world.
No.
My hat is taken off every single day to these wonderful people and what they're trying to do. And I do wish that somebody would listen to us. So whether we need to send yet another letter to express our concerns, that's maybe something that we can discuss at some point.
Absolutely, Chair. Absolutely, Chair.
Is there anybody else who wishes to ask any more questions on this, on Helen's report? I don't think so. If not, then
Sorry.
yeah.
Sorry, Chair. Councillor Lee still got his hand up, but I'm not sure whether that's from the last time.
Peter, have you still got your hand up? Do you want to ask another question? Councillor Lee, you're on mute. I take that to no then. Right, so can we move on now to agenda item 7, which is the medium-term financial strategy, pages 1 to 29. And I believe it's Rachel Cooper's going to introduce this. Rachel, over to you.
Yes, thanks, Chair. The purpose of the report is to consult Scrutiny on the draft budget, which was approved by Cabinet in December, with the focus being on those items relating to children's services that are mainly in Appendices D and E. This year, the budget has been developed against a background of unprecedented uncertainty caused by COVID-19. The financial position keeps on changing, and these changes will be reflected in the final version of the report, which goes to Cabinet in February and then on to Council in March. The main changes to highlight is that the COVID response funding that we're receiving from government continues to rise. Notably, we expect another £5 million of the contained outbreak management funding over and above the amount that's shown in Appendix A. Since the report, we have had the local government finance settlement, which is better than expected. Our forecast for next year is to have resources of 263 million, which is rather than the 259 million, which is shown in paragraph 31. However, on the adverse side, we have reassessed some of our ongoing spending pressures in adults and social care. So all of those will be updated in that future report. In summary, it's a very mixed position that we face. COVID has been and continues to be a human tragedy. In the short term, we have received significant funding to support our response, and our reserves are better than expected, although they are still relatively low to the average. In the longer term, we are still a low taxing, low spending council, and we still show deficits in each of the 3 financial years, which does need to be addressed so that we can be fully financially sustainable. I'm happy to take any questions on the overall position, and there are officers from Children's Services here to answer any specific questions. Thanks, Chair.
Thanks, Rachel. Are there any questions regarding this report? I believe Councillor Christine Perks.
Yes.
And then Sue Ridney.
Thank you, Anne. What it is, and forgive me if I've got confused. Page 22, you've got changing care, charging, resident care, charging fraud initiative. What does that mean?
To adults.
Am I looking at? Yes, I'm right. Sorry.
Okay. Yeah.
I was too good here. And I read it all.
That one was easy.
That one was easy then. Well, the other one is reducing contributions to the regional adoption part. I've got to find the page now.
Page 27, Chris.
Yeah, 27.
Thank you. I've got it down, yeah. What will that mean? Will that, to the borough, will it mean we'll get less services, or do we not really achieve a lot by being with this combined adoption part?
Yeah, I'll let Helen jump in, but my My understanding is that the Regional Adoption Agency was set up a couple of years ago, and we all had fixed contributions that we put into the pot. And now it's been actually ongoing for a couple of years. We found that our share doesn't need to be as high as what we were currently putting in. So it shouldn't change the service that we receive from them at all. And Helen's nodding, so that's good. And, you know, if anything happens, we will review it in future years, but it shouldn't change anything.
Right, thank you. Do we get a good service from this combined service? You know, is it the one we would have expected? Like, are we benefiting from it, or are we paying into something that we've only had a few adoptions from out of the borough?
Okay, shall I jump in on that one? We've started to see the benefits, Councillor Perks. I've got to say, we should have seen the benefits earlier, but that's not down to the adoption agency. It's more down to the way that we manage that relationship as well. So I know that it went to corporate parenting board. Mark Tobin, the team manager for Adoption at Heart, did a very detailed presentation. Lots of scrutiny there, and we've well connected now with Adoption at Heart. Heidi's on the call, our head of children in care. I know Heidi and Andrew are doing a lot of work with Mark and his team, so hopefully we will start to see the benefits now, Councillor Perks.
Oh, okay, thank you.
Heidi, do you want to add anything to that?
I can just say that there is some bits to it to give some reassurance. We've got very, very high numbers of children who we place with extended family rather than adoption. And our foster carers, and Councillor Lee will confirm that, some of our foster carers, or many of our foster carers, have taken children in permanently under different type of order, a special guardianship order. So our reliance on the adoption agency have not been perhaps as good or as high as expected, because of connected families and a focus on keeping children in families where it's possible.
Thank you for that, Heidi. Councillor Ridney.
Thank you, Chair. First of all, page 23, referring to children's services, home, school and transport. Now this is becoming a bit like the painting of the Forth Road Bridge, because this has appeared on every budget sheet, correct me if I'm wrong, Rachel, since 2016. This service has been reviewed, supposedly to find savings. Now, you cannot tell me that after 5 years, we are still seeing it here as a spending pressure, that we have not managed to solve this, having even employed a set of consultants to look at it, and we are still seeing it here as a spending pressure. I think some sort of explanation wouldn't go amiss on this, why we are caught up in this year after year after year. This is 5 years now that this has appeared on the budget as something that is causing spending pressures and that needs to be reviewed. I just find it absolutely gobsmacking. That's my first point. Hang on. Do you want me to do it separately, or can I?
Well, I was going to say, Councillor Ridney, that I think it's been a pressure since well before 2016.
Probably, and we've been going to cure it every year. It's on there saying we're going to review it, we're going to do something about it, and we're still here.
Right, carry on.
Okay, page 27. Now, I'm really quite concerned about this. The letter that we had in the autumn from Ofsted referred to about we weren't meeting our targets for special guardianship, and also concerns about our fostering placements and fostering. And here we see it as part of the cuts. Proposed savings, there it is, children's services, transfer of children's special guardianship orders, review of independent fostering agency placements. Now, if we are going to attend to what Ofsted has said, do we really think we should be cutting those budgets, or should we actually be looking to how we spend that money to get the best value? because I don't think we should be cutting that budget if that is part of our criticism from Ofsted and something we need to address.
I think Heidi, you want to respond to that, do you?
I think just on the special guardianship issue, I know the board signed off on the no detriment policy, and what that effectively means, and that's perhaps where there's some savings. What that effectively means is that some of the children who were in long-term fostering, either with family members or with foster carers, can now take out a special guardianship order, and there would be savings in a different type of way. So whilst the no detriment policy mean that the carer won't be worse off than if they were employed by us, what it means is all the extra costs around having a child in care, for example, your social work visits, your independent reviews, your virtual school contact, all of those build a saving in the background whilst the family enjoy family life, like under the Human Rights Act. So I think that that's a bit of the savings built in there. It also then creates capacity for new foster carers to come in. We want to drive really hardly recruiting new foster carers so that we don't have to rely on independent fostering agencies. There's also a regional project that has been where funding has been secured, where we are working with our partners across the Black Country, where we are looking towards a fostering sharing type arrangement, where, for example, we have a carer who could have a 5-year-old, but not a carer who could have a 10-year-old. But Sandwell has a 10-year-old or 5-year-old who needs a home, but they have a placement for a 10-year-old, that we can support each other across the region in that way. That is projecting some savings. So between that, I think there's some projected savings, but I wouldn't want to see too many cuts to that service because we are really desperate in fostering.
Yeah, and can I just to reassure Councillor Ridney that permanency does remain our number one priority, as you described rightly so. That you know, in terms of the Ofsted assurance visit and permanency being a priority action for us. So this isn't about compromising the service, as Heidi's just described. There is slippage in the system. It's about being more cost effective. Councillor Ridney. So, but I mean, this is something that, you know, you will be cited on because it is our number one priority in children's social care at the moment.
Can I
hang on.
Can I just come back in again?
Yeah, go on.
And just page 27 again. Also, the movement of external placements into internal residential placements, that is proposed to rise over the next 3 years, saving. How are we planning to do that? How are we going to make savings on that when our drive is to bring our people back, our youngsters back into the borough, bring them back from those placements that are God knows where in the country, to bring them back into their homes at their home borough, so they're closer to their existing families and to their friends and to the places that they are familiar with.
Yeah, can I just interject there, because those two issues regarding managed step down from external residential placements and the movement of external placements, those are I would like to know how we are going to achieve that. Yeah. But going back with regards to what Sue said about the pressures for the home to school transport, and then the reduction of school transport for SEND children, those I think that these are the first question you asked, Sue.
Yeah,
that needs to be addressed, because it is an issue that has bothered this authority for many years. And yes, we know that it's a pressure, but then we see that we've got a saving for SEND children. So I'm trying to sort of quantify how it's going to work. So we do need some answers regarding that. That needs looking at before we can actually agree to, you know, signing off this this budget.
Yeah, Yeah, thank you, Chair. Thank you for that clarification.
Helen, are you okay answering the home to school transport? Or is there somebody else in your team?
There isn't anybody else in my team. I've got to say, I do hear what is being said, and it's difficult for me to give that detailed response because it's just come under my domain. So what we've done is we've Nigel Kletz in procurement has convened a working group where commissioning and our send professionals in the send team and transport are working with Nigel to look at this particular issue to try and resolve it as you've described once and for all, because it has been going round. I can't give you any more information than that, which is, you know, I feel that I feel like I need to give you a detailed response, but as I said, it's just come under my domain, and I'm just getting to understand it myself. I do hear that there has been constant reviews, and that, you know, we can't keep reviewing the same thing really. But all I can say is, as a form of reassurance, is that we are, you know, there is a working group, procurement heading up this working group, and I'd hope to kind of bring that back here at some point. I know that doesn't help, and I know that doesn't really answer the question, but I can't give any more than that information really at this stage.
Right. I think that if we can get some information outside the meeting going forward, then we can look at this again. Can I bring in Councillor Sahota, please? He's got his hand up. You're on mute. You're on mute.
Can you hear me now?
Yeah.
I think Sue and Christian has basically said what I wanted to say. Those are headline figures, Helen. There's big figures there in terms of the cuts. What we need is the firmer detail behind those figures and what that will relate to in terms of jobs, service level agreement, and what we can provide. Because, you know, that we need to see the finer granular detail of what these costs will mean, how we're going to sort of what they mean, because that doesn't tell us anything, and that's where our concerns are really in terms of what Sue and Christine has just said. Okay.
Yeah, I think that's what we need to see, and I have a criticism sometimes of the budget is how are we going to achieve those savings? What does it actually look like to us? Because it's all right being a line on a report, but we need to know how we're going to do that.
Can I just come back in there, Chair? I mean, I think
Councillor
Sahota's query about jobs. This isn't about saving jobs. These are just about the placement costs of an individual child's placement being reviewed, and so that the cost that the price that we pay a provider, we anticipate to go down, or we've got something set up internally, an internal residential placement or any sort of internal placement which will be cheaper. So it's definitely not jobs.
Okay, I think what I meant to say there, actually, I fully understand what you're saying. What I meant to say is, obviously we're redesigning a service. That will have implications how it's delivered.
We won't be redesigning services, Councillor Sahota, regarding this. It's how Heidi described. It's about being more efficient, to trying to prevent children from going into external placements in the first place. Heidi's got a hand up, so it's more about how we're managing where our children are being placed. As we described, Ofsted picked this up in the autumn, and this is an absolute #1 priority, making sure that, you know, we get our forever homes right for our children right from the beginning. Heidi, do you want to come in?
I'm happy to. We have just I've written the permanent strategy and it's out for consultation at the moment. So far, everyone is very happy with it, and we hope to roll it out as soon as next week, when we start training, working with our social workers across the county or across the local authority to understand the permanent strategy and the focus on early permanence. What we want is to keep children close to home. We're also looking at several different models where we can support children back home sooner. So you may have heard about No Wrong Door as a working model. So we're looking at setting up a working model where we draw across the council from different parts of children's services and education, a model to support families to care for, because what we see, the rise in carers for young people between 11 and 15 who've perhaps had really difficult and adverse childhood experiences and who now can't be contained at home anymore, and they need just additional input. But what we find is if they do come into care, and Councillor Ritney mentions that, they move further and further away because they struggle to make care work for them and end up in very high cost residential placements all over the country, and really struggle to make care work, and the placements can't hang on to them because what they really want is to be home with mum and dad. So we are developing services where we can really focus on reunification and strengthening mum and dad, or mum or dad, or an auntie and an uncle, or a whole family to look after children better. And that could be a seesaw type model where we work alongside some of our children's homes. So it is, we're working very hard in the background to develop that model, especially we've got the opportunity with Maitland Road, reopening after all the refurbishment, and so there's some energy there to really do something different, and thankfully we've got different help from all over the place. We're also looking at really from the front, very, very front door, what can we do to prevent children from entering care, because children growing up in care inevitably, not all, well, most children who grow up in care for life don't have the best experiences, don't have the best outcomes, and we want to really be ambitious for our children. So could we have better support for them when they're in their homes? Could we have better support with them when they're in their extended families, is the question we're going to ask from the start right through. So that should effectively help us to reduce the pressures on placements and ensure that we just have the right children who needs to be looked after in our care, and revisit that throughout the child's life, because we know people do change. Not everyone changes as fast as we want to, but people do change, and that's why we're social workers. So, to invest more in that change for people later on, so that kids can go home later on if they couldn't go home at the time when courts made decisions. So I think that I hope that answers some questions around, our models for the future and the investment we hope to bring.
Thank you, Heidi. That was very comprehensive. And I think a lot of the time, if you have that background information and and you've explained it quite well, that how we're looking to make those savings, then that sort of makes everybody sort of sigh with relief that we're not going to be slashing and burning. We're doing what's right for the child, but we're looking at it in a different way. And just that explanation has allayed some of my concerns. Can I bring in Jeremy, who's got his hand up now, please?
Yeah, thank you, Chair. I was just going to feed back on an earlier conversation about the travel budgets and the spend on that. And it's just to say, as I'm sure everybody knows, in terms of budgets, it's not just the big high level reviews, it's some of the sort of smaller decisions on the ground. And certainly since I've been in post, I've set up a regular Friday afternoon meeting with the travel team, and we've started being a lot more rigorous in terms of implementing the protocols and making sure that we only agree to parents getting or children getting the transport if they genuinely meet all the criteria. I think it's quite obvious to me that there were a few that in the previous regimes were rolled through. They were quite lax interpretations, and then parents get into a legacy issue where they've been used to the transport year after year after year after year, and they haven't quite met the mileage criteria, and it's quite difficult to stop it. But we've been a lot more rigorous in terms of making sure that we interpret it very, conscientiously on the ground, because one decision to apply transport for the year can be hundreds, if not thousands of pounds when you look at it per day. So we've been a lot more rigorous on the ground, Chair.
Thank you very much for that. I've got Peter Lee with his hand up, and then I've got Councillor Perks. So Peter Lee, Councillor Lee.
Hello there, Chair. Chair, I'm chomping at the bit here. As you know, well, as you know, me and my wife are foster carers for Dudley. We have 3 SGOs and 3 foster children in placement at this very moment in time. And I've wrote a list out here of the things I would like to ask. But do you know my biggest concern with children in care? Chronologically, most of our children are not at the age they should be at whatever age they are. Does that make sense?
Yeah.
And I am more than concerned about the letting children go out of the care system, whether it be fostering, permanent, SGO, whatever it might be, at 18. I feel it's far too young. I feel it's very dangerous, and our children are so vulnerable. I'm doing a lot about the drugs scene at the moment. I'm not on the drug scene. I'm doing a lot of work with that and with the police and on the county lines and stuff like that. And I'm horrified at what happens to a third of our children. A third of our children has been proven that when they go out of the care system, they either go into drug problems, drug dealing, drug pushing, or they get in trouble with the police, one thing or another. And that concerns me greatly as a foster carer for our children in this borough, that we need to raise the age of the 18 is too young. Chronologically, our kids aren't 18 when they're 18. They are far younger than that. They're not chronologically where they should be at 18. But I'm not going to rabble on anymore because I'm a guest on this committee tonight, and I've got a list here, and I really would like a really big in-depth talk with a senior at some stage, because I've got lots of things I would like to ask. But
yeah, well, thank you for that, Councillor Lee. And I know that you're subbing for Paul Bradley, and I've said a few times before that you ought to be on this committee anyway. Let's hope that we can get you on this committee because you give an insight.
I would love to be.
But I think that possibly a chat with Heidi, if you could arrange that, outside of this meeting. And I think, Peter, you can give insight to Heidi. Heidi can give you insight as to how our systems work and what we can and cannot do. So,
yeah,
perhaps you could sort that out, Heidi. Get in touch with Councillor Lee. Thank you very much, Peter, for your contribution.
Thanks, Chair.
I've got a call on Councillor Christine Perks.
Thank you, Chair. Mine goes back to the transport, and when they said they was looking at it, it's always been a bit of a pet hate of mine as well. Do we look at, when I was a respite carer, we used to have children, the parents had a car, a mobility car in the name of the child, but used to put the children on the bus at 9:15, whenever it was, and wave them off to school and pick them off the drive when they came back. Does that still happen? Because what I'm saying here is we're actually paying twice for transport. We're giving them the money to have a car. Now, I know it's not always possible, especially if you've got, like, say, 3 children and then different ages, but I think it should be, if they've got a car, they should take the child to school unless they've got a good reason for not taking them and putting them on a bus. Half them used to be 53-seater when I was aware of it, half empty to block up the drives into school when the parents could have done it. And I just wondered whether that still happens, because obviously that was a while ago.
I can pick
Jeremy,
that
you
up,
want
Chair.
to
I mean, I've
respond?
been with Dudley now for 9 months. It's not something that I've come across. I mean, most of our transport funding is either direct to taxis themselves or, in a smaller case, to parents who want to access bus passes, but the vast majority of it is paid direct to transport.
Does that answer your question, Christine?
When you say it's paid direct to transport, we're still having coaches taking children to school.
The vast majority of what I deal with, I can only speak as what I deal with, Councillor Perks, is there's a special needs transport which is paid directly to the contracted transport companies. In other words, the taxi companies and the licence providers. We don't very often pay direct to parents.
Now, I'm not talking about paying direct to parents. What I'm saying is the parents got a car, a mobility car, in the name of the child. But they still have transport to school being paid for by the council. And it used to be a full bus coach going. And I know they still go. I know they still turn up at our park school and park outside. What I'm saying is, should we be looking at, when we're talking about saving on transport, should we be looking at saying, well, you've got, and doing each person individually, because everybody's circumstances is different, but should we be saying to that parent, you've got a car, you should be taking that child to school unless there's a good reason not to, as we're providing for a bus as well that takes them and brings them back. You understand what I'm talking about, don't you, Ellen?
I absolutely do understand what you're talking about, Councillor Perks, and that is something I couldn't tell you how many examples that we've got at the moment, but that is definitely an area of focus for us. Definitely.
Yeah, it really used to bug me, and still does, to be perfectly honest, because half the time the children never actually go out in the car, and you know, it's being used to ferry everything else.
Yeah, we definitely will be really homing in on that area of activity. As I said, I couldn't tell you how many families we've got in that situation as it stands, but we definitely will be looking at that.
Okay, thank you.
Thank you.
Thank you, Christine. And can I call Councillor Ridney again?
It's just a minor question, really. Page 22, where it talks about contact centres reviewing the delivery of family contact for children looked after in a post-adoption support to ensure that the service is delivered effectively, efficiently and offers value for money. It then says 30,000 and then it goes on to pass the pressures. Are we talking about not having a physical place, or is it about support and persons? You know what I'm saying? Is it about that we haven't got enough physical rooms to take care of this, or have we not, or do we need to enlarge them, or whatever? What actually does that mean?
This was a saving that was put forward for 2021, so this financial year. But through a number of reasons, and Helen might be able to explain those, we haven't been able to deliver that £30,000 saving. So what we've done is just we've reflected it in our outturn report, which we show in Appendix B, and also we've sort of covered it for next year, so that it won't be an ongoing issue in future years.
Yeah, because thank you for that, Rachel, because basically, Councillor Ridney, we're not in a position to make any savings in relation to family time. We can't reduce that. We don't want to reduce it because it's absolutely key. So that's in terms of how Rachel's just described that. There won't be any further changes in relation to family.
Glad to hear that. Glad to hear that, because I was about to take your task, if you were. Because I think that's a really important part of the work that we need to do. But I just wanted to, whether it was about not having rooms for it or whatever. But thank you for the explanation. Thank you, Rachel.
Thank you. Councillor Pete Lee, you got your hand up again.
Yes, Chair, it's just a quick one. Just to say, we've got 4 different schools that we take our children to. every day and collect every day, and are really, in this climate with the drugs problem around schools and on the way to school, I would hope that all carers would do that, take the children and collect. I mean, we've got two 13-year-olds. They hate it. They hate me taking them. They hate me picking them up. But they'll have to put up with. I'd rather do it and know that they're home and in school safe. So
Thank you, Peter.
thank you.
Thank
No
you.
problem. Thank you,
Right.
Chair.
Councillor Sahota. You're on mute.
Can you hear me
Yeah.
now?
Yeah. No, you put it back on mute.
Oh, can you hear me now? Yeah.
Yeah, yeah.
Okay, just a final comment really to sort of compliment Rachel on this report, because I think she's the only officer that actually has written the quality impact assessment in actually how it should be written. Now, I think she should be used as best practice for other authors, because there's 2 reports after this report where there's been little written under those sections, and that is something I think I need to raise this at a committee, you know, but I think it needs to be noted.
Thank you for that, Harmjit. But I thought that we had a template for our equality impacts throughout the authority, so shouldn't they all be the same? Somebody hadn't answered the question.
The template is the same in that there is a section, and then it's up to the author of the report to ensure that it's completed. But we do circulate it across the council. So I have to say I didn't write it, but I did coordinate it.
Councillor Sue Ridney, you've got your hand up again. No, right. Is everybody in agreement as regards the recommendations on page 1, which is that the committee considers and comments on the Cabinet's proposals, the medium-term financial strategy to 2023-24, taking into account the considerations set out in paragraph 38, which I'm not going to read all the way through. So does committee agree?
Well,
Right.
no. Yes. Well, no, because we haven't got the explanation that we asked for the transport.
Yeah, but well, right. I think we need to add a caveat to that then.
Thank you.
That we would require more information regarding the transport pressures and
Savings
obviously
under there.
the savings as well. So if we could have that information, then of course we can then go forward with this. So do you agree to that, Councillor Ridney? Does the rest of the committee agree?
Yes, thank you.
Right. Thank you very much indeed, Rachel, for that. So if I can move on now to agenda item 8, Children's Services Customers Complaints Response Times Action Plan, pages 30 to 32. And we've got Darren, have we?
Yeah, thank you, Chair. Good evening, all.
Good evening.
Members will recall that when we presented the last annual report back in June last year, it showed that the response times was only around 41%. That's responses within 20 working days, and obviously members raised concerns about that. We came back to the meeting on the 9th of September and we presented a process and an improvement process that was intended to try and drive performance up in this area. And members asked at that meeting that we report back in future meetings in terms of whether that's had any impact. And that's the purpose of this report. The current data is showing us that since we introduced the revised system on the 18th of August, the response times has now increased to 65%. So that's an improvement on the 41% that was previously reported. So whilst it is an improvement, I think we still accept that, you know, we still want to improve that further. And we still continue, as my team continue to provide regular reports to Helen and her management team in terms of how we're performing and any issues that are arising on that. Another issue that members requested us to develop our systems on, and we did as part of that improvement process, was to try and find more information as to the reasons why complaints was late. And so what we've done again is, as I said, we've changed our systems and processes, and we've looked at the complaints that was responded to after 20 working days, right back to the 1st of April this year. And the main reasons for these delays that work has shown is that 53% of the delays was as a result of other work pressures. So this is the feedback from managers. We've asked them to provide an explanation as to why that response was provided late. So the main reason was 53% of cases was that there was other work pressures. 16% was due to staff absence, and 13% was the result of the case being a complex case with many facets and possibly different teams involved in that. What we also found was that when we looked further at the reasons on the other work pressures, a lot of those reasons that the delays occurred in the court management and the care management teams, which due to the nature of their work will always generate the most types of complaints. And I mean, Helen may want to comment later, but I know managers are looking at what additional supports can be put into those areas to support them, to help them raise that. Just to supplement the work, we obviously introduced a new process back in August, but to further supplement that, what we've developed in conjunction with the Centre for Professional Practices, we've got a series of workshops running now throughout the rest of this year. The first one is actually being run tomorrow, which is for managers. So it will cover the complaints process. It will detail some of the issues that we've had in the past, and it will just outline what the process is and what their responsibilities and the roles and responsibilities of everybody is in the complaints process. In addition to that, the Centre for Professional Practice is developing an audit tool that will sample complaints, not just to look at the reasons why they was late, but also the quality of responses. And then the key findings from them, the case picks of the audits, and that will be reported back to services. The final thing really to say is that we tried to get a feel for where we sit. 41% was not good, but we wanted to try and get an idea of where we sat regionally, really, in terms of our response time. So we're part of the West Midlands Complaints Officers Group. So we asked for their feedback in terms of what their response times was for complaints within 20 working days. We had feedback, and the response times from other authorities ranged from 50% to up to 73% of responses being made within 20 working days. I think the other thing, because the one that came back with the highest performance was Sandwell. So we took the opportunity to speak to Sandwell in a bit more detail, really. To try and find out what was they doing, was there anything we could pick up from, anything we could learn from. And after these discussions, I think it became apparent that the process that Sandwell introduced and the measures that they do very, very closely follow what we've now introduced from August. And I think their feedback was that, their improvement wasn't immediate. They didn't immediately jump overnight from 50 to 73%. But it was by constant application of this process, which my team are trying to achieve with Helen's staff on a day-to-day basis. But also, but more importantly, they say that one of the key factors of this was senior management buy into this, where senior managers are aware of complaints that when they're coming up to be due, and everyone works hard to try and make sure that the responses are provided on time. And I think that's a core element of the process that we've tried to develop now within Dudley. I don't know whether Ellen wants to comment, but I'm happy to take any questions on where we're currently at.
Yeah, I think just sorry, Chair, just going on the back of what Darren's just said, I we're in a position now in children's where we've got a full permanent head of service team now. As you know, autumn last year was quite a difficult time for us, where we didn't have a full complement of head of service. Now we've got our senior management team in place. This is one of the, again, a priority for us to drive in terms of complaints, and as Darren's articulated, a really detailed report in terms of the training, and it's not just about the response, it's about the quality of the response as well. That's really important here, and part of new managers coming into the service, this is a key feature of their induction now, and it's something that we're taking very serious in children's. And as you can see, as Darren said, 61% is still not good enough, but it's improving. So we'll continue to really drive that forward. The SLT is definitely on board with this, and we'll continue to support our managers. As Darren said, I think it's important to note the majority of the complaints that come into children's social care is within care management. That's probably our most pressurised area at any time, particularly during COVID as well. So I don't want to use COVID as an excuse, because it's not an excuse. But care management is a particularly pressured area that currently Andrea and myself and the other heads of service are currently looking at how we can really support that team at the moment.
Thank you, Helen. Councillor Sue Ridney.
Thanks, Chair. Only just to say thank you very much for the report, Darren. I applaud your efforts. At least you're doing your best. And the problem is, having gone into another lockdown, that's going to make life more difficult for you yet again. But well done, and thank you for coming back with the report. Thank you.
Okay, thank you. Thank you.
Thank you, Councillor Ridney. Yes, if I can just echo what Sue has just said. I mean, we were very concerned about this, but you've took it by the scruff and given it a good shake, and we're on an upward trajectory. So, well done, and I look forward to to see that we get high 80s, early 90s even at some point. But thank you to the team for everything that they're doing at the moment under these difficult circumstances. If I can just go back to the recommendations that the members note and comment on the contents of the report and the improvements in response times, and if going forward, if we can just have some regular updates. Darren, thank you very much indeed. Can I now move on to agenda item 9, which is the education report, pages 33 to 61, and it's Jeremy, I believe, who's going to take us through this. Jeremy?
Yes, it is, Chair. Apologies if you can hear a bit of background noise where I'm sat. I'm underneath a skylight and it's absolutely tipping down. So I hope you can follow what I'm saying. What I'm going to do, everyone, is I'm going to dip in and out of the report, because obviously since I put this together sort of early to mid-December, we've had the festive break. And what I really want to do as well is to just update you on a number of things that have happened. And as we've talked earlier with the lateral flow, it's an ever-changing feast at the moment. And I think there's various updates that I can give you as you go through that hopefully will be of use. So if I start with the education section, there's a piece here on the education strategy, and members will know that I've previously been to strategy and talked about this in September when we just launched it. And just as a quick recap for others that weren't on that call and in that meeting, the idea of the education strategy was to put together an overall framework for everything we do within education in Dudley, and also, as is increasingly becoming the case, to link it into other areas of work across children's and across the council. So it's working really, really well. We've spent a lot of time launching it. And with any new initiative, it's important that you get the launch right and you get the buy-in. So a lot of the focus has been on getting the relationships right with schools, getting the relationships right internally in terms of the council, and really building a culture where everybody buys into this. It's built around, as I've said when I was here last time, 6 key principles. And just to remind you, the idea of 6 principles, as opposed to a really detailed narrative at this stage, is in relation to the fact that particularly in our secondary sector, as many of you will know, we've got 19 secondary schools, but 15 of them are spread across a number of multi-academy trusts. So we only directly maintain 4 out of 19, and we've also got an increasing number of academies in our primary phase. So if we have a very prescriptive driven curriculum central curriculum education policy, then there's a risk that some of our multi-academy trusts won't buy into it as strongly as if we base it on key principles. So I won't go through them in huge detail, but they're about buy-in and everybody having responsibility. That's the first one. That's under item 5 if you're following the actual paper. One of the key parts of this and one of the key principles that we're working through is making our schools more inclusive, and that links into a lot of work that we're doing across the sectors, everything from social care through across to our SEND provision, making sure that our mainstream schools are more able and to a large extent more willing to take children who have special needs. Obviously, I think we had this debate last time, and I just make clear that I'm not suggesting that children that have the needs that need specialist provision are put into mainstream for the sake of it, but there are a number of children who would traditionally have gone into our special schools that we are now urging some of our mainstream schools to more actively consider. And quite regularly now we get into conversations with heads where a consultation is approached to a mainstream school. They will allege in the first instance they can't meet needs, but we challenge them, and often we do get those decisions reversed, because for many children with special needs they can flourish in mainstream. It's just making sure the culture is there to give them a chance. And as Helen and I have discussed on many occasions, we've got a bit of a legacy culture in some of our schools, not all of them, but some of our schools in Dudley. They haven't been inclusive down the years, and we've got quite a big mindset change to get in place, which is why I focused a lot at the early stages of getting the relationships right. If you can have an open conversation with heads and they're open to listen, it is certainly a lot easier. So there is some movement on that. For example, the other day I sent out again all of the what I call the inclusion data to all of our schools, and that will be a sort of a debate and a context for our meetings this particular half term, and it has fixed term data for the various schools. Schools are comfortable with that now. When I first started sharing everybody's data with all the other schools, they were a bit unsure about what we were using it for, but it's just about being transparent and making sure that the data is out there, and it's that narrative, isn't it? Statistics are not the answer, but they provide the questions that you can have. In terms of the continuity, that builds from there, because obviously we've got to make sure that our sectors are joined up, and part of the context as well is a financial one. We've been in budget working group this week and schools forum next week, and there's been a narrative there about reducing out borough spend. We do spend as a borough a significant amount that probably we could save if we organised our sectors more in a more continuous way within the borough. So if our mainstream schools are taking some children that would historically be in special schools, there are places in our special schools that cater for some of the children that we're at the moment procuring quite expensive out of borough places for. But that it's a big piece of work. And the other piece that underlines some of this is a piece that I'm doing with Dawn Goodall, who's our principal EP. And it's just looking at the designations. In other words, the way we actually categorise some of our special schools. We've still got, I think I mentioned this last time I was here, Chair, we've still got schools that are designated MLD in our special sector. Well, MLD doesn't exist in terms of the code of practice. Our deficit area is looking like it's probably more in the area of SEMH, social, emotional, mental health. So there's a piece of work about making sure that the specialisms of our special schools match up with the needs, the primary needs, if you look at a cumulative sum of children's individually HCPs. Reducing exclusions is a big piece of work. And again, it's about putting that challenge in on individual situations, but we're also rolling out an alternative provision strategy. I'll talk a little bit about that later, because that's actually referenced again in the paper going on, Chair. So I'll skip over that one for the moment. One of the big pieces of work that we've worked on really hard internally is making sure that our teams are a lot more coordinated, and there's several reasons for that. One is that they understand what each other do and we can be more joined up and the way that we approach schools. But it's also secondly about credibility. And one of the things we're working on this very week with our education teams is they're all doing a little pen portrait, which we're going to put out to schools just to remind, because there's about 15 to 20 different teams within education outcomes, from your visual impaired teams, hearing impaired teams, admissions teams, Dudley Performing Arts, Dudley Virtual School. And it's just to making sure that we're all fully joined up. What we're starting to do, we've been doing it since the start of the autumn term. We meet every single Monday. We talk about, we might have a caseload of schools that we talk about, and we discuss what we're doing individually in those schools, what we're doing collectively. The way we then have a meeting later that week or the following week with the senior leadership teams of those schools. We report back what we're doing, we take feedback, and it's a nice loop now in terms of improving what we do to help improve and challenge the schools. So that's really embedding itself in terms of the way that we work. And as I'm hopefully doing now, communication is really important. I have a system now, a way of working. It's not exactly a system, but I do a monthly update PowerPoint, and I then cascade it out to various audiences. Obviously, this is a paper chair, not a PowerPoint, but I will be doing that PowerPoint with Schools Forum next week, with Governors Group next week, and all the different headship groups and so on and so forth. It went to Primary Forum last week. I've just spotted there's a typo in there, so apologise to that in the middle of 10. So the idea of the education strategy is that framework. And if you scroll down now just below 11 onto the next page, there's a diagram. So what we've put in place there is an education strategy group. So this is a group that Helen and myself sit on. Our two school improvement officers, Joe Moores, who does the secondary and is also currently our acting senior school improvement officer, Matt Osborne, who covers the primary phase, Ruth Wiley, who leads the AP policy that I'll talk about in a minute, and Dawn Goodall, who's our principal EP, and Sue Powell, who's our SEND manager. We all meet weekly. And the idea is that we're coordinating the way the strategy rolls out. And the piece of work we're doing at the moment is what's called a SEF. And in the jargon, that stands for a self-evaluation form. So what we're looking at the moment is a really comprehensive evaluation of all that we do across all of our services. That will turn into quite a weighty document with lots and lots of appendices, but fundamentally there'll be all in one place a summary of our judgments, our self-evaluation of what we think of all of our services, because we don't want other people, were they, to come into Dudley and look at what we're doing to find things. It's a basic Ofsted model that, and I've been ahead in past life, and that's the model that Ofsted use in schools. They expect schools to be able to evaluate what they're doing, and from that evaluation put together the plans going forward. So that's where we're up to, and we're going to invite another local authority to come in and look at it when it's done and cross-pollinate, cross-moderate, check that our evaluation is right. And then from that there will be an improvement plan which will guide our work going forward. What is shown underneath is the way that things work at the moment with some of the various subgroups that relate to the education strategy group. Those will probably change over time, so some of the groups may merge, and depending on the things that we decide to work on next further to the self-evaluation. I mean, I'm already aware that school readiness is an issue in Dudley. We haven't probably historically done enough with our post-16 providers, so that this will respond to the needs that we identify through the self-evaluation. But I'm really happy with the way that it's working. And we're also getting really strong engagement now from our schools. I put out just before Christmas, it's just a snapshot really, the last week before Christmas, when everybody is tired, looking forward to a break, hopefully last week in a COVID term, a COVID year, we put out would anybody like to work with us as part of a teaching and learning group, working with the local authority heads and so on. I thought, well, if we get half a dozen people, that'll be brilliant. We've got 32 schools, which is pushing a third of our school population wanting to work with us. So we've got a meeting on Friday where we're going to get everybody together, and we're probably going to end up with 3 or 4 different groups that we can work on different aspects, such as transition or closing the gap assessment. So that's just a little indicator, Chair, of the way I think we are starting to shift the culture. We have a bulletin that goes out twice a week, which a few months ago was just information from the local authority on supporting schools, government guidance in terms of the COVID situation. We now quite regularly get good practice shared from schools, and we're proud to be able to put that in. So it's a good little indicator of how schools are really buying into the fact that we're engaging with them in a slightly different way. The second section in this, I suppose, is paragraph 12, where we're talking about Ofsted visits. And again, I'll just kind of take the paper as read and give you an update. But essentially, from the time we came back in September, the model that Ofsted are using has evolved. When we first came back, and you'll see pasted into this report, Chair, that there are various reports that go back to October. This is because, as I said at the start, the paper was written early December, and at that time there is a sort of a lag period between Ofsted going in and the report coming out. But essentially, what they were doing then was just having virtual conversations with schools, and the narrative in sort of September, October time was around how are you getting back into school. Remember, the schools had been closed to the majority of pupils since sort of early spring, so children have been out of school for a significant time, and the initial interim visits were around the themes that are in this paper. If you look down on sort of paragraphs 18, 19, 20, they were around things like safeguarding behaviour and attendance, very sort of general conversations. And as I'm sure you've done, if you go into some of those embedded letters, you'll see they're fairly narrative written. There's not a judgment on the school. It's just, thank you for your time to meet with me today. We talked about. So that was where we were in October. As we moved towards Christmas, and it became evident to Ofsted and various others that we weren't getting back to business and normal anytime soon in terms of Ofsted. And for those of you, I'm sure you do know this, a normal Ofsted visit, if you're in a secondary school, as a head myself, I've had those, you would normally get a team of 4 or 5 inspectors with a lead inspector, an HMI or a Reggie as we used to call them. They would come in and they basically do a process called triangulation. So they might talk to you as the head, they'll talk to senior leaders, they'll listen to what you've got to say, and then they go and test it by talking to subject leaders and year leads. They talk to children, they might talk to parents, they talk to governors, they go all over the school. Well, that's not going to happen anytime soon with the way we're working in bubbles. So Ofsted, moving towards Christmas, started to refine the way they were doing this in terms of really focusing much more on the curriculum discussion and talking about particular subjects in much more detail. So at the time, just before Christmas, they were tending to talk to schools at about 5 different subjects. It was usually maths, English, and then 3 other subjects, usually history, science, music. They would pick 3 different ones. We found out afterwards there would be a week when they'd have 3 particular subjects, and then the next week they'd choose 3 more. That was how they were working it. And we haven't had any visits this side of Christmas. The model has now changed slightly again, so that schools that are on a monitoring list, so schools that might be in a requiring improvement category, they're talking about possibly going back on site and doing those visits actually by visiting schools. But that was a couple of weeks ago, so that may have changed again. One of the things that we're really conscious of now is there's a lot of work coming out around remote learning. There's some guidance came out this week asking schools to start to self-evaluate what they're doing with remote learning, because obviously the expectation now is that we're probably not going to be back to normal anytime soon. You know, you've all got your own views, I'm sure, on when that might be, but I would be very doubtful myself if we're going to get children back in any numbers before sort of March time at the very earliest, particularly with all the changes on the lateral flow that we talked about earlier. That was the government safety net in a sense, and now that's no longer there. I'm not quite sure where it's going. But what's becoming more important is the remote learning. So we've got a working group set up with that. We've got a survey monkey that went out today. So by Friday, we'll have the data back to actually analyse what schools are doing, who's doing remote learning, who's doing written learning. And, you know, there's nothing wrong with doing non-ICT learning. We just want to know what's out there. Are schools monitoring what children are doing, the engagement? Are schools aware of who's online, who's doing the work? Are they assessing it? Are they getting feedback? Is there any welfare support? So all of those things are things we're looking into, because we're conscious, apart from anything else, that Ofsted are going to be picking that up when they come into for their next visit. So the point I'm making here, Chair, is that, you know, the Ofsted model has changed hugely since this was written early in December. The next section, I'm going to skip over a little bit, the special educational needs section, although I'm obviously happy to take questions at the end. Tony, our head of SEND, wrote this, and I think it's very well written, and it's quite explanatory in terms of the journey that SEND has been on. SEND has come a huge way, and as I said earlier, we're working very closely between SEND and education now in individual situations to support the SEND team in making sure that our schools do respond to consultations, they do meet needs, and they're much more responsive. And a lot of this is written in the context that obviously as Dudley we're still working towards showing that we've met all the actions within a written statement of action that we need to respond to the department further to the visit in the spring of 2019. There's also recently been it's currently going through a self-evaluation of SEND provision, which will also link into the SEF that I talked about earlier in education. If we go on to paragraph 27, this is the bit about the alternative provision strategy. This was launched earlier last year, or the planning for this has gone on since last year. The launch out into schools is only now taking place. And there's some background data there as to why we needed as a borough to focus on alternative provision. Depending on which stat you look, they're all pretty much the same in terms of exclusions. We are very high on league tables for the wrong reason in various other contexts, whether you look within the local West Midlands area or nationally, we tend to exclude large numbers of children. So there was clearly a need to put in place a clear process to address this and to reduce this down. So if we go on to paragraph 29, the principles of the project or the AP strategy are listed there. One of the things, or the top two, really link together. One of the things we had to do, obviously, was to make sure we have got enough provision, because we got to a point last year where we were actually struggling to make sure we operated within the letter of the law, and the guidance or the Education Acts require us to make sure on the 6th day that a child is excluded or out of mainstream school, they have got an alternative placement. We were really struggling at the end of the previous year to make sure that all of ours, and particularly some year 11s, were in place. So there was clearly a need to establish demand-led place planning to make sure we got enough places and to commission those. But the real way we need to work is to make sure that we don't exclude those children in the first place. There could be an argument if you expand too much provision, then you're actually making it easier for children to be excluded. And as I said earlier, inclusion is one of the issues for a number of our schools. Number 3 has actually been changed since this was written to inclusive pathways. And the idea there is to put in place a range of support for schools. So if they get to the point where they really are struggling and they're identifying children as being at risk of exclusion, be that a fixed term exclusion or a permanent exclusion, we've got something that we can actually do to support them. And that may be a range of EP support, mentoring, specialist subject support, support through connections, etc., etc. So it's about having something that you can actually put in place. I mean, a supportive phone call is all very useful in certain circumstances, but schools don't get to that position lightly. We're dealing with some very experienced head teachers across some of our schools, and they don't make those decisions easily. And we need, as a borough, to be much more supportive and responsive to that. We've actually got an advert out internally to do a secondment from a school into the local authority to add capacity to support that. So that is going really, really well. Kate Blackmore and Ruth Wiley are leading that project, and that's one of the real successes. Something else just to update you all on, Chair, I'm doing some work. I think I've got a meeting tomorrow with some of our primary CEOs and on Monday with our secondary CEOs. We're working much more closely with the multi-academy trusts, and they've expressed an interest in also working with us collectively to provide alternative provision capacity across the borough. And that's, again, another example of how we're working much more closely. We haven't got any absolute dates on that and clear sort of what we're going to do, but it's really important that we work with our multi-academy trusts as well as with our maintained sector. What Kate has done, Kate did a lot of this section. So if you look through paragraphs 31, 32 and so on, she's just given you a timeline of where we're up to and the plans going forward. Section 34, Chair, I was asked just to put a section in on illegal off-rolling. As you were seeing 36, it's not an issue in Dudley, but it's something we do need to keep our eye on, particularly around census time. My last local authority kids did, until we clamped down on it, occasionally go missing at a round of a census. It basically means the school takes children off roll. It often happens in year 11. They might have children who are not predicted to get great grades or are not attending very well, and they just disappear off the roll, because obviously if the bottom line goes down when you're doing a percentage, the percentage goes up. Ofsted, this is actually a quote from the Ofsted criteria, the framework that schools should not engage in off-rolling or gaming. As I said, it's not an issue in Dudley, but you just asked me to include that in the report, so it's in there. And the final one is just a quick summary of the virtual school. Andy Wright put a lot of this together, and I think the part to draw everybody's attention to, Chair, is under paragraph 40, where Andy has put the results. If you read this in the context of the cohort, 48.3% were identified as having special educational needs, I think you can agree that the exam passes are quite significantly impressive for those children. For those of you still working old money and are still thinking in terms of A stars, A, B, C, the gradings, I'm sure most of you know, and now go from GCSE from 9 down to 1. So a 5+ is, the idea is 5-ish is the old C pass in the old money, so to speak. So when you've got 48% of children having identified special needs, to get 30s and 20s getting those good passes is a good set of results. In terms of the rest of the paper that Andy's written, he's just gone through then and indicated some of the other projects that he's been involved with and giving you an update on some of the areas that they've been involved in terms of art. So I remember when I was last here, Chair, updating you on the Dudley summer provision last year, and some of that work with arts and the challenge tuition programme has continued, as with the sports. So that's a sort of a whistle stop through there. I'll just finish, if I may, Chair, and do the bit on education, elective home education, and I'm happy to take questions. I think it was Councillor Millwood asked that we could, Helen and myself, could just include something on elective home education, because it's an issue not just for Dudley, but it's an issue nationally. We became very aware of it in Dudley right back in September. And this was when, as I said earlier, when schools were returning after the really long shutdown up to September, we spotted a spike in elective home education. So elective home education, it sounds fairly obvious, but it's where parents elect consciously to educate their children at home. The spike that we started to see in Dudley, we immediately communicated that to the DFE. And myself and Helen have regular weekly meetings, sometimes twice or 3 times a week with the DFE. And it quickly became aware that other boroughs, Sandwell, had a similar issue, and it was a national spike. And what we were starting to see was that this wasn't really elective home education at all. It was masked largely by parents who, and you can understand it in a pandemic, they were anxious for their children to be in school. They were anxious about their children going to school and coming home if they were vulnerable or they were shielding. So they were not sending their children to school, not because they were opting positively for elective home education, but for many of them, they were aware that they could get down an enforcement route. We could end up with fixed term penalties, of penalty notices rather. So it's rather an avoidance of enforcement rather than a positive choice for elective home education. So what that presented us with as a borough was a need to, in a sense, separate out the two. Within that, there were genuinely some that wanted to go down the route for the right reasons, but it's been a challenge in terms of capacity, because all of those children have had to be assessed, or all of the parents have had to be assessed to see if they actually can deliver home education. As a parent myself, I've still got a year 8 lad, and getting him to do his work on a morning when he's not in school at the moment is hard enough. So to actually commit to elective home education as a lifestyle choice for several years, I'm not sure some parents actually realise when they go down that route what they're really letting themselves in for. So we have to assess that in every single case. I brought a paper to Scrutiny last September, but just to give you a little bit of an update since then, our current active caseload is 425. So that's comprised of some children that are actually on elective home education, but there's about 100 at the moment who are in the assessment process, and that's not a one-stop assessment. Sometimes you have to go back to parents several times. It's leveled off in recent weeks at around 425. What is impressive is that we are increasingly working through that caseload. Since September, 32 children out of that initial 100 have returned to school. And that may not sound a lot, Chair, in the context of 425, but every one of those is a lot of individual pieces of legwork, quite literally sometimes, and assessment. Our data at the moment is currently in line with national. I said this to Helen, I was a little bit surprised when I read the figure. Nationally, 0.9% of a number on roll are in elective home education. So in simple terms, that's telling us that nationally 1 out of 100 children is in elective home education. That is the figure. I've double and triple checked that because I was quite surprised when I saw that. But our figures are actually in line. So in terms of, and I can send this through, Chair, if this you want to put this out, but essentially of the 425, they're split around 50-50 in primary and secondary, with round about 30 or 40 per year group. There's no particular year group where there's suddenly twice as many children. There are no children in reception. I don't think many parents would look for elective home education in reception, but once you get from year 1 through to year 11, there's not a massive difference in terms of any of the year groups. So what we've done in terms of our capacity, we've currently got a job description for an additional post that we're recruiting to. That's just gone through job assessment. That's going to go through there very soon. So we're doubling our capacity in terms of another person to actually go out and do the assessments. But in the interim, we've redeployed some time from Education Investigation Service and also increased the admin capacity to make sure we've got the capacity in terms of staffing to deal with this spike while we work through. As I said earlier, Chair, it has leveled off. So we're hoping we're through the sort of worst of it now in terms of numbers, but obviously we've got to clear that backlog and we've put the capacity in. We're also working very closely with CME, Children Missing Education, and Early Help, because some of the children cross over, not just to being elective home education, but they also cross over into AIRS. So I've with Helen and myself have spoken about this a lot. We're very aware that it is an issue for the council, but we're confident we've got the case and the staff load and the capacity there to actually work through this. So that brings me to an end, Chair.
Thank you very much, Jeremy, for that. It's just a couple of things I'd like to pick up on. I hope you can hear me. I'm in the conservatory and there's a monsoon going on.
Snap.
It's dreadful. So if I'm talking a little bit loud, it's because I can't hear myself. We are going to be bringing a working group, so this is for the benefit of the committee, regarding children missing education, which will also encompass the elective home education issue as well. I've had a discussion with Helen today about this, because I do think that it's something that we need to look into and reassure members, because a lot of us are getting, sort of phone calls. We get sometimes phone calls about, dodgy neighbours who's dobbing them in. They're saying they're home educating, but they're actually hanging around on the park. And these are the issues that we have got to look into. So thank you for bringing that to that part of it to the report. But we are going to be looking more in depth, and I know Councillor Rigney is very keen that we do this as well. One of the things I wanted to ask you about it was at the start of the report about schools being inclusive, and as you quite rightly pointed out, I mean, I've been in this game for 20 years nearly, and I'm well aware of schools who flatly refused and would do everything in their power to offload kids to another school because we don't want people with children with SEND children within the schools. And you did mention some data, and I just wondered, does your data show in all the schools the number of SEND children? I would assume that it would, but is there any way that, well, I'd like to see that data if it is possible. I'm not sure if anybody, if that can be provided for us. And The other issue, the other thing I was going to speak about, I've forgotten where I've marked it down. Oh, it'll have to come back to me. So if you want to carry it, if anybody else wants to ask questions, or if you want to take them all at the end, is that all right, Jeremy?
I'm quite okay with that, thank you.
Yeah. Well, I think Councillor Christine Perks.
Sorry about this. I went to get me a glass of water. The question I was wanted to ask was page 34, when you're saying we're looking at developing commission inclusion centres in a number of the mainstream schools, that this is centres will provide for pupils when they are dysregulated and will give sanctuary during the unstructured times. Can you explain that to me, please?
Yeah, certainly. I'll do it more at the end, Councillor Perks, but I can do that, yeah.
Thank you, Christine. Councillor Sahota.
Hi, Chair. Just a quick question, really, for Helen, really, as the main lead officer for all these reports. Helen, how is the quality impact assessment being assessed by the report authors? Whether are the officers, do they understand the obligations under the EIA when they're doing these reports? The reason I say that, it's been an ongoing issue with the reports. For example, we've had the complaints report, and Darren refers to quality diversity. Now, I'm looking at I'm looking at what the councils should be doing under the Quality Act, and then again on this report, which Jeremy's done a nice detailed report. Right at the end, under paragraph 57, we've got a one-liner. Quality impact will continue to be considered. My understanding, it's not an option. It's mandatory. So to me, as somebody takes quality opportunity seriously, when we have these reports, I have to say, Helen, this has been ongoing for some time now. Are they really looking into this in detail and actually make sure they're ticking the boxes? Because the evidence doesn't seem to suggest that. Now, this is something I will raise with Mo. I've raised it before. One-liner for a report like that has a lot of implications on different communities, different characteristics. To me, that's not acceptable.
I'll take.
No, but it's a one-liner. The quality will be considered. It's not an option. It's mandatory to look into that detail. How are we going to deliver this strategy to make sure we cover everybody? If there's, I'll read it here in front of you. Demonstrate the regard for public sector equality duty. There's two folds. Identify possible negative impact of decisions and on individuals and sections of the community, and plan mitigate actions accordingly. And the second strand of this is identify opportunities to advance equality within policies, strategy, and services. Now, that one-liner doesn't say anything.
No, I agree, and I picked it up before, Councillor Sahota, in terms of what you said around the complaints report, and I've noted it, and I think it probably is it's an area of focus that I'll take back and ensure that all of our reports give that detail, because I agree with you.
Yeah, that's good, Helen. Is that all right, Councillor Sahota?
That's fine, but I think my understanding is it's been going on for some time, and to have a detailed report there, educational strategy, to have a one-liner, I think that is poor. Right. But that's all I want to say, because it's something that's really, but it needs to be escalated, because people in senior positions shouldn't be writing reports like that with one-liners. Thank you.
That's noted. Thank you. Councillor, I think Serena Craigie.
Yeah, thank you, Chair. It's on elective homeschooling again. You mentioned that you were assessing parents, etc., and also about the criteria within the elective homeschooling. I know that is an issue at the moment. What are the assessments? So, and also are you lobbying the government for a better standard criteria for it as well? And secondly, paragraph 36 on the illegal off-rolling, you mentioned that if an officer suspects a school of doing this, I should imagine that there'd be some teacher involvement with that if there's off-rolling that they wanted to be hidden. So what is the mechanism for finding out that that is happening? Thank you, Chair.
Yeah, if I can just say, Serena, a letter was sent from our committee to Gavin Williamson regarding the issue of elective home education, and we're still awaiting a response.
Thank you. I realised that I didn't know the response.
Councillor Ian Bevan.
Thank you, Chair. Thank you, Jeremy, for your report this evening. Very comprehensive. If I can roll it back to paragraph 10, I'm particularly interested in the proposals for increasing the secondary capacity in Halesowen, and I was wondering if you could share those proposals with us.
Anybody else got their hands up? Serena, I think you've still got your hand up, and Councillor Sahota.
Me.
Sorry.
Okie dokie. So if there's no any, oh,
Me.
Oh, you're not showing.
Oh, it says it's on here.
I know it isn't on mine. Go on.
Oh, you knew I'd have something to say, surely. Right,
Yeah.
thank you, and thank you, Jeremy. A comprehensive report, as our colleague has just said. Just one or two things, and actually, I was going to refer to paragraph 10 as well. But first of all, I need to say, because I didn't mention it, because we're talking the virtual school in here. Can I just declare, Kim, I am the chair of the management board of the virtual school. So, paragraph 10. Okay, which was about where it talks about capacity in Halesowen. I would like to know, are we looking at the capacity across the borough? As I'm sure Anne will back me up, we need something in the north of the borough as well, please. We need to look at that secondary capacity within the north of the borough as well. So let's not just look at it in little pods. If you're going to look at it across the borough, please. Most important that we do that. And again with the elective home education, but actually I've already had a conversation with officers about this, and I think I'll wait till we get to the working group, to be office councillor. You know, I've shared my views with you, and Helen knows my views. I'll wait till we get to the working group. But if we're going to look at school places and where they should be, please don't just confine yourself to Halesowen. You know, the north does have children, and we have got children scattered at schools right across Sandwell, Wolverhampton, because we haven't got capacity in Dudley at this end of the borough. So it does need looking at, and I make a plea for that, and I have made a plea for that since 2016, since you shut Caseload. So, you know, can I please, let's not just confine it to Halesowen. Dudley is bigger than Halesowen. Okay.
Yeah, I understand.
Thank you.
I understand. Okay, Chair.
That's all the questions. Okay, Jeremy.
I think I've made some notes. Okay. In terms of the data, Councillor Millward, that's fairly straightforward. We can arrange for that to be circulated through. We've got an issue with collecting some of the fixed term data from some of our multi-academy trusts. So we need to work through that, but we have got the data up to date from where we are now with most of our schools. That went out to schools. So that includes percentage of EHCP in each school by number on roll and fixed term exclusions. How I worked that one out is number of children who've had a fixed term exclusion in the term. And as some of you might be aware, you can crunch fixed term exclusion data in terms of number of exclusions, and sometimes one child will get several exclusions, and that tends to skew the data. You can also measure it in terms of days, but I've worked that out in terms of the number of children, and then there's a similar figure for PEXs, and we've got that historically. It also goes back, and you can look at it in terms of townships as well as individual schools, so I can make sure that that's made available. Councillor Perks asked about the inclusion centres. This is just one of the ways that we're exploring in terms of making some of our mainstream schools more inclusive. it's a model that I've seen in other local authorities, another authority that I worked in, and it works particularly well for certain SEND needs such as autism. So you might have a base for autism within the school. So the presumption with these children is they will go to the majority of their mainstream lessons. But if they're having a day where they do feel dysregulated, they're having a bit of an off day, there's somewhere that they can go just to get a little bit of respite. Some of these children often get into a little bit of bother in the unstructured times when they've got break time. They need a little bit of structure. Sometimes these centres just having staff around them and a structured activity rather than just literally running around the playground and getting into scrapes. So that's the function of it, Councillor Perks. So the presumption is these children will go to the majority of mainstream lessons, but this is kind of a safety for them in a sort of sanctuary sense in terms of when they're not having a great day. Councillor Bevan and a couple of you have asked about.
Hang on a minute.
Sorry.
Can I ask you the question, or do you want me to ask it to finish?
You can ask me another question now, Councillor Perks.
Oh, thank you. What it was, I basically knew what it was. So you're saying you're going to have like a quiet room that if they have they get full of anxiety or stress or whatever, they can get to this room and stretch out and calm down.
Yeah, I mean, when I've seen it working really well, Councillor Perks, it's more than a room. So you'll have highly trained staff, mentors. I've seen sensory gardens. I've seen structured activities. You know, people who can talk to the children when they're ready and see when they're ready to go back into lessons. But it's a whole range of support. It's a little bit more than a quiet room, but it's just to support some of those children when they just need time.
So you're going to pay for extra staff then?
Well, the way it would work, if you, I think I said this last time, if you imagine a sort of a continuum line with mainstream schools on the left and outer borough on the right, you're trying to shift things for some children from right to left. So some of the funding will roll back. So rather than paying so much for your outer borough expensive placements, you've got more money to spend on our maintained services. So you're freeing up money that you're not paying to the likes of Wenlock allegedly, that comes back into Dudley, and then you can service it from that. It's obviously a lot more complex than that, but it's not going to be extra money. It will come back from the savings on the outer borough placements.
Right. If these children that have moved, because we know if you've got autism, it doesn't always go away overnight and things like that. If it is proved that after a period of time that the mainstream school is not for them, that the inclusion centre is not for them, do they then get reassessed to go back to
I mean, it would be the same process, Councillor Parks. You know, if it becomes apparent that a school can't meet needs, then that's a decision that it wouldn't change. And we're just trying to change the culture. And as I said earlier, we've got to put the support into the schools. We can't just say to the schools, you just need to expect these children to go to lesson 5 periods a day, 5 days a week. So it's that kind of thing. I mean, the other thing just to say is we're not expecting to literally take children out of special schools and put them into mainstream. This will be a work over time. What we're trying to do is stop some of the children going into out of borough in the first place. We're not suggesting that a child who's been to a specialist school will suddenly just be taken out. So it's not looking at it on that level. Children will always be where they need to be.
Okay, thank you.
Thank you. The places, shall I do EHE first, and I can link a couple of the other questions together. I mean, in terms of, I think it was Councillor Craigie who asked about EHE. I mean, as the chair has said, we have you have written a letter to the Secretary of State about EHE, and I think in the previous report that I brought to Scrutiny, there is not enough actual robust guidance from the government in terms of how the assessments do need to be made. But we do work very closely in terms of our team. We are looking at quite literally, have the parents got the wherewithal to actually deliver education? Are they able themselves to deliver the education? Have they got the financial means to actually pay for the tutors? We go into it in a great detail, but some of that, to be fair, is our own process and structure, because the guidance around exactly from a national level isn't there. But we're confident that we are working through in a very systematic way. In terms of the off-rolling, it's just about making sure that when you get the census data, you check it rigorously and you're making sure it doesn't happen. We've got various checks and balances in terms of the data that comes into schools on our various systems about children that are on roll. So as long as we're picking it up and checking it through our EIS service, we can pick up where children may or may not disappear off roll. But as I said, it hasn't ever been in recent times an issue in Dudley, but it is a practice that we're very aware of, not least of all in protecting schools from themselves, because it is a clear Ofsted judgment. In terms of the places, we've done a lot of really active work on the place planning strategies since I started, and we've shared a lot of data with schools. We've done some work across the borough in primary. So what we did before the summer, I think it was we had meetings with township groups of heads. We shared all the data, and coming through in 2-3 years time, there's a dip in birth rates which will hit primary. So we've worked with all of our schools and we've consulted, and it's a paper that's working through due process, and Helen may know exactly where the paper's got to, but it's been through DLT. Consultation paper where we've got 4 of our schools to actually agree to reduce their pupil admission number, just to enable us to manage that process. It hasn't actually meant that any schools will have fewer children in them. We just had a number of schools where their admission number was way over the number of children they were actively taking. So we've got schools that have an admission number of 60 but regularly only take 30 children through. So we've reduced that capacity. We are required for statutory to assess this on a regular basis. So there's 4 schools. And interestingly, as in the conversation that I had earlier about engagement, a couple of our multi-academy trusts were willing to support us with that statutorily. We can't enforce that on multi-academy schools that we don't maintain. So there is a whole borough process, part of the answer to Councillor Ridney, in the primary sector. In terms of Hales Owen, a similar situation is coming through in the same sort of time period, and we just needed some capacity in that area. So we looked at that specifically, and I had a number of meetings with Richard Sadlier, who's the officer that looks at that school planning places. And we met with the CEOs, and the thinking was if we could get them, again, in the way we're trying to work between them to come up with a solution. So again, Helen, I'm not putting you on the spot, Helen, but I don't know quite where the paper's got to, but it's been through DLT and it's in the consultation stage. So essentially between Leaso's, Earls and Windsor, they have agreed within themselves to look at a possibility, if assuming the paper is approved and goes through the due process, that they will come up with a solution for taking in additional places to make sure when that bulge goes through, we have got the actual capacity. Obviously, there's a costing implication on that paper, and it's going to be scoped in terms of either temporary buildings or whatever. Earls and Leaso's might need additional actual building capacity in the short term. Windsor is just a very small increase in numbers. I think they've agreed to take about 7 or 8 extra children, which they can take without any extra buildings. So that's working through. And as Councillor Ridney will know, there are plans still in formation in terms of capacity in the Coseley area. We have been working very closely with the DFE and with Mark Grundy, who's the CEO of Shirelands Collegiate Academies Trust, in terms of a free school in that area. So we are actively looking at extra capacity in the Coseley area. I think that's all the questions, but if I've forgotten anybody, I'll come back.
Thank you for that, Jeremy. Anybody else got any questions? No, I don't think so. Well, thank you very much for that very comprehensive report. And if I can just draw members' attention to the recommendations, which is that members note and comment on the contents of this report, which I think we have done in quite some detail. Thank you very much. So we move on to agenda item 10, which is to consider any questions from members to the chair where 2 clear days notice has been given to the monitoring officer. Council Procedure Rule 11.8. There are none. Thank you very much.
There are none, Chair.
Thank you very much, everybody. Thank you for your input, and I will see you again at some other meeting. I think council's the next one, or if not, our working group. So we'll send out the date for that as soon as possible. Okay, thank you. Good night.
Thank you.
Thank you. Good night.
Thank you, everybody.
Thank you.
Thank you. Night.
Thank you. Good night.
Bye-bye. Good night.
Stay safe.